Let's get into this vaccine. It was quite a shock that came through yesterday. Big news that AstraZeneca has had to press pause on its vaccine and the program that's got underway there. Just how long that pause is, we don't know yet. There's some estimates that it'll be around 4 weeks. But I guess, a bigger picture here, does this kind of show the complexities around making the vaccine and perhaps we shouldn't be putting dates on these things and kind of raising expectations only to have them dashed?
Yeah, exactly, Pete. I think we've discussed this in previous interviews. The expectation management game is front and centre for governments when it comes to handling COVID and all aspects of COVID. And we've seen, generally speaking, that's gone okay. But, we're seeing already some differing views from the federal government. The minister's sort of adamant that the first quarter next year is still the plan in terms of the first delivery of vaccines. And today we've got CSL, who's obviously would be the key Australian manufacturer, and even the AMA and other experts saying that it's more likely to be the second half of next year. The experience of these things is that generally they're 2 to 3 years from research right through to production line and public distribution. So obviously, there's a lot of focus and investment from the government on this and high expectations, and we need it in terms of living with COVID. But you've got to be really careful in terms of managing public's expectations here because we are going to be living with COVID without vaccines. And then even when the first line of vaccines come on, it's going to be a while before we get that proper take-up that you need across the population.
Andrew Bolt, he's got his critics, but he has a point. Last night he said on Sky that, we've just got to put that to the side for a while because it might not be around for a long time. There's never been a vaccine for coronavirus. So we've got to work out ways to live with the virus and the elimination strategy that a few of the premiers are going for at the moment. Is that the right long-term measure? I'm not sure it is.
Yeah, look, it's absolutely the focus from the government needs to be on suppression. And that's right. And I think we saw in the interview that Sky had with the Premier and Kerry Chant that the expectations are that the vaccine's a long way away and that their plans around restrictions and having COVID-safe practices and public transport and work practices, that's the focus for a long time. And that's really the focus for the government for the next 12 to 18 months. And that should be what we're all thinking about. There's no rush here.
Yeah, it was a great interview Andrew Clennell did with Gladys, and she mentioned she's got different philosophies on different things depending on what party is leading the state, but she points to the fact, and we're seeing some figures come out today of the GST hit, but Gladys mentioned that maybe the problems aren't there now, but 6 to 12 months down the track there could be some huge economic problems.
Yeah, we continue to see that really, the damaging data, the economic data, but also the budget impact. And that $30 billion write-down in terms of GST collections is, I think, over the next 4 years. So we're just going to see the impact that we see in terms of negative quarters of growth and unemployment. We're obviously feeling that right now, but the implications for the budget, for the economy, for personal well-being are going to be experienced in years down the track. And it's just another very brutal reminder today about that impact. And because we know states are relying on payroll tax revenue, stamp duty, but also indirectly that GST pool. So state budget's really being whacked now too.
What about politically too? Phil Curry has written a piece about that today in the AFR. Politically and federally, some Labor MPs do have some concerns about where things are in Victoria, about their own position.
Yeah, it's interesting, the power of incumbency, Pete, and regard, state governments have obviously got some mixed performance issues, and we saw Michael Gunner did really well off the back of his handling of COVID a few weeks ago, a re-election which people thought a few months ago wouldn't be possible, and obviously there's different experiences across the country now. So I think there's probably a concern that with the federal election likely to be as early as the second half of next year, and if that's obviously well before the next Victorian election, that could be the next test in Victoria about handling of COVID. And so that will start to play in, I think, and that start to be a concern on some federal Labor MPs' minds. But I suppose quite rightly they'll be asking questions of the federal government about the federal government's performance on things like vaccine and aged care. And so all is fair. It gets thrown around, and incumbency can work both ways. Yeah,
and people will be watching the Queensland election, the results of the Queensland election very closely. That's the next one up, and to see what kind of effect that's having from decisions both federally and at the state level.
Yeah, exactly right. And I think that that in some ways COVID has brought Anna Palaszczuk in Queensland Labor back into the picture. They were been trailing for a long time, and I think that Anna's personal stocks have gone through the roof, and I think that's partly down to her handling. There's still really low numbers when it comes to COVID, and when we know, and as we discuss regularly, the border war situation with Queensland, it's controversial inside and outside the state, but it seems to be going down well within the state, despite some of the economic impacts that might be having. So, yeah, we'll see, I suppose, in the next 6 weeks about how that plays out in Queensland too.
Well, still in Queensland, and, you know, she's under the microscope again, giving favourable treatment, it would seem, to people in high places. You've got Tom Hanks, who's come back into town. He's got to finish off that Baz Luhrmann film on the Gold Coast. Remembering that he picked up coronavirus, he was actually the first big name, I think, to actually contract the disease. So now he's back. He doesn't have to do hotel quarantine, though, and it's miffed a lot of people.
Yeah, look, it's one of those awkward situations, I suppose. It's not necessarily the best look when you compare it to some of the concerning cases of people in northern New South Wales who are trying to get in for very important and essential reasons. It's a tricky one, but I suppose at the same time, I mean, it's pretty hard to expect that Tom Hanks is going to be, you know, you're publicly seen to be in room 41 of the Brisbane Mantra. That's probably a security risk. And I suppose there's other conditions when it comes to Queensland attracting this global investment, when it comes to having those stars come in and out. Look, not the best look, but it's one of those things, I suppose, that we need to deal with when it comes to Queensland. We still want to have those exports, and to be frank, you know, the movies and the films, and from an entertainment perspective, it's still an important export, and we know there's jobs attached to it for Queensland. More
so now than ever. Just finally, are you okay, James?
Yeah, and there's more to say after Are You OK, which I think is a really important thing, Pete, that Are You OK has been a fantastic catch cry for sort of getting mental health on the top of our minds and thoughts, but it's actually the follow-up which is important. So today, for me, it's like things like, you know, are we doing things like mental health first aid training? Are we, after asking Are You OK, are we making sure that if it's a negative response or a concerning response, that our friend or colleague are perhaps going to a GP and booking in an appointment and maybe going with them and attending that. So it's actually the follow-up which is important. So a bit of focus today on the follow-up, and there's some really good social media I see this morning from Are You OK? So people should avail themselves of all those resources.
Yep.